Good evening to everyone joining us here tonight, friends, family, colleagues, and yes, even our patients. On this day, we at St. Luke's Medical Center, together with everyone around the globe, are celebrating World Sleep Day 2022.
That is right. The night is young, maaga pa naman, and aren't we energetic, diba, Doktora? We are so glad to have everyone with us here tonight, and we are obviously excited about what we are going to talk about. But first, let me spoil you a bit, no? Konti lang. Since it is World Sleep Day, this evening will be all about learning how to end tonight and hopefully all our successive nights on a good note with better sleep. So my name is Dr. Pito.
And I am Dr. Grace, and we will be with you for tonight's talk, Let's Sleep on It, the power of sleep for mental health and overall well-being. We know that a lot of us have at some point experienced having difficulty with sleep, especially during these times. Maraming nahihirapan matulog or nagkaka-insomnia, pinipilit na matulog sa gabi pero hindi pa rin makatulog. More than 10 million adults in the Philippines are suffering from insomnia. And without a doubt, this number has even grown as a result of the pandemic.
Alam mo, tama ka, Grace, no? Indeed, what the world has gone through these past couple of years has no doubt caused us stress on so many different levels. Kumbaga, hanggang sa pagtulog, inabot na tayo ng stress, di ba? No? At syempre, dahil dyan, most would agree that the state of our mental health affects our sleep, and in the same way, the quality of our sleep also has an effect on our mental well-being.
Are you having trouble sleeping? Are you having trouble sleeping? You are not alone. Various studies worldwide have shown that about 1 in every 3 persons suffer from sleep-related problems. Sleep can be improved by simple changes to sleep-wake patterns and practices. We call these changes improving your sleep hygiene. Everyone from children to older adults benefit from better sleep, and sleep hygiene plays a key part in achieving that goal. Here are the important practices for good sleep hygiene. Set your sleep schedule. It is important to get up about the same time each day, on weekdays and even on weekends, to help maintain a daily rhythm that is in time with a 24-hour light-dark cycle. Morning sunlight exposure is important for synchronization. Light is one of the key drivers of circadian rhythm that encourages quality sleep. An efficient sleeper is someone who is asleep most of the time they are in bed with the lights out. If you are awake for a large part of the night, maybe you're spending too much time in bed. Try setting your bedtime a little later or your wake-up alarm a little earlier. Proper sleep environment is conducive to sleep. Avoid extreme temperature, bright light, and noise in the bedroom. Relaxing prior to bedtime can set the stage for a restful sleep. Bed is only for sleep and sex. Avoid watching television and using cell phones or laptop in bed, as these can cause mental stimulation that is hard to shut off. If you're having difficulty sleeping, it may be related to cigarette, caffeine, and alcohol use. Both caffeine and nicotine are stimulating. Drinking alcohol before bedtime may make you sleepy, but it has a rebound alerting effect that can prevent a good night's sleep. Regular exercise improves restful sleep. However, one should avoid working out too close to bedtime, as exercises increase one's adrenaline and makes it hard to sleep. Hunger or excessive fullness can disturb sleep. A cup of warm milk, banana, or cookie are sufficient to quell hunger pains at night. Lying in bed and worrying that you're not getting enough sleep will only make it worse. If you are unable to fall asleep, get out of bed and do some quiet activity like reading until you are sleepy, then go back to bed. Eventually, sleep will overtake. Making simple changes to your sleep-wake pattern may be all that is necessary to improve the quality of your sleep. the basic concept of sleep hygiene, that your environment and habits can be optimized for better sleep, applies to just about everyone. So, since a lot more people are aware of the importance of taking concrete measures to take care of your own mental health and wellness, now we ask the question, what about our sleep?
And to answer that, we have invited two of our very own sleep medicine specialists at the Comprehensive Sleep Disorders Center of St. Luke's Medical Center. We have with us here si Dr. Roland de la Eva and Dr. April Hernandez. So let's welcome our doctors. Thank you for gracing us tonight with your presence, Doc.
Hi, good evening.
Good
Thank you
evening.
very much for joining us, Doc Roland and Doc Pim. For the sake of those who are joining us live, would you kindly tell us a bit more about yourselves?
Ladies first.
Okay, hello, good evening everyone. I'm Dr. April Hernandez and I'm a mother of 3 kulit kids who does not want to leave me. And we all co-sleep together, and everyone also snores in the family. So we own 2 CPAP, actually 3 CPAP machines.
Wow, what
Okay.
what better way to explain to your patients kung pati ikaw mismo na naranasan din yan sa bahay. Thank you. And how about Dr. De La Eva? Short intro.
Yeah, good evening. So I've been in practice of sleep medicine for the last 20 years. So when I came back from my tenure, so that's the time that the Comprehensive Sleep Disorder Center was inaugurated. So I'm part of the history.
So institution na si Dr. De La Eva, no? He
Ibig
as
sabihin, matanda na.
as the institution itself. Founder. Thank you, Doc.
Matanda
No?
na.
Di pa naman, Doc. But thank you for being with us. Sa pag-intro niyo pa lang, parang feeling ko na mas makakatulog na kami ng mas mahimbing mamaya. Di ba, Grace? No?
Yes, of course.
Yeah, well, kidding aside, no, if we want to get better sleep, no, so let's jump into it. No? What better way to start than by asking the experts themselves? And yun ang ginagawa natin ngayon. They are right here in front of us, with us, beside us, kung nasa naman ang laptop mo. No? And for those of you who are joining us live on YouTube, no, you may type in your questions in the chat box and we will do our very best to answer them as the discussion goes along. Para naman dun sa mga nandito sa Zoom, you can also type in your questions in the Zoom chat box and we will try our best to include them in our discussion. Gusto natin interactive tayo ngayon, di ba, Grace?
Yes, of course. We'll be entertaining hopefully all your questions. So let's get started. Actually, nowadays, a lot of people tell us, Doc, nahihirapan talaga ako to sleep at night. What do I do and where do I start? So let's start with a hypothetical patient na I think marami sa audience ang makaka-relate. Yung hindi makatulog for the past couple of weeks. Siguro meron lang siyang around 4 hours of sleep, hirap siya mag-initiate ng tulog. Any advice on how to go about this problem, docs?
For April 1st.
Okay, so it sounds like insomnia, no? So if an individual complains about difficulty initiating, maintaining their sleep, or if they wake up too early from the usual right time, we consider it as insomnia. So when you experience this, it's very annoying, no? Kasi parang prior to experiencing that, sleeping was very easy, masyadong madaling matulog. So nagiging mahirap yung tulog. It's gonna be very difficult if we start worrying about it. Once we start worrying about not being able to fall asleep, then hindi ka na talaga makakatulog. So there are a lot of techniques on how to sleep better. The treatment or the management of difficulty sleeping is individualized. So it's better if you follow the sleep hygiene technique mentioned earlier in the video, it will help you better your sleep. But if it didn't work, then you have to get a consultation.
May follow-up question ako doon, Dr. Hernandez, no? You
Sige.
mentioned that the way to treat sleep or sleep problems is individualized. Ano ibig sabihin nun? Iba-iba yung need natin for tulog, no? Meron bang magic number dapat na yun ang amount of sleep na meron sa na nakakuha sa isang gabi or in one night, no? And then maybe I think after Dr. Hernandez, Dr. De La Eva might have some input on that as well.
Right. So let us hear from Dr. April first.
Yes.
There's
So
a follow-up question.
the magic number. They always ask about, Doc, I need 8 hours. I need 8 hours of sleep. So you will read a lot of researches telling you that you need enough hours of sleep. There's a table that we follow, a graph that shows that when you're younger, you need more sleep, and then it somehow gradually decreases as you age. And these are mean sleep. Ibig sabihin, karamihan sa population would get that sleep. But some people are considered long sleepers. Some people are also considered a short sleeper. So, kaya siya individualized kasi it's better to see the body clock or the hours, the usual hours of sleep of an individual. Then we compare kung mas konti ba siya or nakikit niya pa ba yung usual sleep niya. Then we could say kulang na yung tulog niya. Pero kung tinatanong mo ko how many hours, it actually depends on the individual. There. Dr. De La Eva.
Yeah, yes, I agree with everything that Dr. April said. No? And also regarding you have to individualize the treatment or the approach to the management of this patient is, as we consultants in sleep, we usually take note of the 3 P's, no? So Dr. Keaton, Dr. Grace, the P's, precipitating factor, predisposing factor, and also what is perpetuating factors. No? So before we address the patient's problem, we first try to know what could be the root cause of the problem. Okay. And looks like the other thing is that it's just a couple of weeks, so it's just like most likely the insomnia is just more of adjustment insomnia. It's not get caught with insomnia. So I guess hopefully that wouldn't be that difficult to manage this patient. And also the other thing is that it's a very common expression of patients na nahihirapan, di ba? Nahihirapan. So kung iisipin mo, nahihirapan ka if you try too hard. Diba? If you try too hard, laging sinasabi ng mga pasyente na nagpipilit ako. So for the last couple of days, nahihirapan ako matulog. So it's correct that he's exhibiting all the symptoms of insomnia, inability to initiate. He wakes up before the desired time of waking up, and then he cannot go back to sleep. So those are elements of insomnia. And also it looks like it has been mentioned also that this daytime efficiency is suffering as well. No? So the treatment would also vary aside from knowing the predisposing factors, because these predisposing factors have to be addressed as well, and also the duration of the insomnia may also be different. Okay, so looks like we're still just dealing with an acute one. No?
Okay po. So we talked about yung number of hours of sleep. How about so weekdays? They don't sleep much on weekdays, but they try to make up for it during the weekends. Is this good or bad? So.
Yeah, for me that's not good. I think it's always important for you to practice consistency or regularity. That's what I always tell my patients. Because anytime that you change your wake time is the most important thing. So wake time, you have to have consistent wake time, because anytime that you have changes, sometimes that can alter your rhythm, your biological clock. So that can be a problem later on. So for me, personally, I advise my patients to have consistency, and that's the key word, and that's the most important thing. Consistency in their sleep-wake schedule.
I see.
Okay.
Yeah. So we call that social jet lag. It is when you get shorter sleep on weekdays, tapos babawi ka on weekdays.
Parang guilty tayo dyan, no, Grace?
Yeah. So that would only mean that you are sleep deprived. because you need to make bawi on weekends.
That's
Chronic sleep deprivation is also not good, no? It can affect your cognitive functioning, like your memory, your alertness. It can also affect your mood. So there's a increased tendency to experience anxiety, depression. There are also medical conditions that are due to chronic sleep deprivation, like heart diseases, stroke, breast cancer. So maraming effect yung chronic sleep deprivation. So if you are that person wherein you need more sleep on weekends, that means you are sleep deprived on weekdays.
Yeah.
Hindi yun,
Correct. Yeah. So
So
that's
there's
when,
such thing
yeah,
as pabawi on weekends.
yeah, that, that's what you call homeostatic mechanism. So the longer you stay awake, the drive to sleep becomes much higher. So during the weekdays, you don't get the opportunity. So this is tantamount more to like insufficient sleep. And if there are symptoms already, that creates a syndrome. So you have to differentiate insufficient sleep or sleep deprivation due to sleep deprivation due to sleep insufficiency and also insomnia. Because in sleep insufficiency, you can have the opportunity and also the good circumstance. But in insomnia, you have the opportunity and the good circumstance, but you're not able to sleep. But
So
both of them can lead to sleep deprivation.
So yun yung
So,
difference. Pag
Yeah,
meron
that's the difference between the two. Yeah.
versus wala, okay.
Yes.
Minsan
yes.
kami yung may kasalanan pala.
And sometimes it's volitional, you know? So kumbaga parang wala kang control sa sarili mo, you don't have any discipline. So that's where the problem starts.
So I guess same concept applies po yung dun sa mga tinatawag nating night owl.
Oo nga.
Yeah, night owl.
And wake
shift
up
worker.
morning.
Yes. Night owl, specifically those patients with delayed phase syndrome, no? Yung mga kabinatan, kadalagahan, so they're night owls. So, but of course, during the weekdays that they're supposed to wake up because of like school obligation. So of course, you cut short their sleep time. So what happens is that like when you're given an opportunity the weekend, so sila bumabaw.
Okay.
Yeah, yung problem natin sa night owl is if they have responsibilities aligned with the normal schedule. Like, yun, papasok sila ng 7 o'clock pero natulog sila ng 5 a.m.
Tapos may mga school yung bata sa umaga.
Yan.
Oo.
So, when they wake up, imagine, it's like, if I sleep at 10 p.m., I need to wake up at 1 a.m. to go to school. So how can you function very well if your brain, if your head is still at 1 a.m.? So yung ganun yung nafe-feel ng night owl if they need to accomplish responsibility nila during the day. So that's the difficulty. Pero there are individuals who can actually function as a night owl. So if these are the shift workers or the call center agents, so matutulog lang sila during the day. So it really depends on the lifestyle of the individual. So pwede naman yung night owl.
Okay. Depends din talaga dun sa lifestyle. But in terms of yung lifestyle, doc, or yung iba kasi nagpa-purchase ng maraming gamit to help them sleep. Like kunwari, earplugs, or they buy yung blackout curtains, or white noise machines. Are these add-ons or room features recommended, or nakakatulong ba talaga sila to help us sleep better?
Yes.
Yeah. So, yes.
Yeah. So you're para April.
Yeah. So part of the sleep hygiene, diba? The room should be dark, cold, and quiet. So yung blackout curtains mo, yun na yun sa dark. The temperature should also be cold. Quiet. So you ask about white noise, no? So white noise, yung goal kasi ng white noise is to dampen unexpected noises in the middle of the night. So kunwari nakatira ka tapos maraming dumadaan na cars sa kung saan yung bedroom mo. So you can use white noise para hindi mo masyado marinig pag may mga dumaan.
Parang it drowns, no? It drowns the noise, no?
Yes. So yun yung use ng white noise. Earplugs, I think Pito, correct me ha, you're an ENT specialist. We need a certain decibel, no? So yung wala talagang noise would actually yung wala kang naririnig na sound would cause more anxiety among patients kasi wala na talaga silang naririnig.
I
Uh,
agree.
so, 'di ba, we need a certain decibel na naririnig ka pa rin. So
Sanay
hindi
tayo
siya
sa ambient noise eh.
oo.
Kahit pa
So
paano.
parang yung earplugs hindi yan masyadong effective.
Not
So
so
if
much.
you want to block out yung mga unexpected noises, doon ka na lang sa white noise.
Mhm.
And also the other things, siguro, like ako, I'm a pet lover. So isa rin problema yan. Like for example, if your dogs sleep with you, it's just like co-sleeping. No? So these dogs really don't matter. Like if they jump on you, so of course that can disturb your sleep. And even co-sleeping is also another thing. No? So comfort in the room, of course, your mattress and everything. So those are important things. No? And whatever suits you, I guess. So, but generally, like having the room na malamig and then dark, without any gadgets, without any clock or watches, or any what's this television. It has to be emphasized that television shouldn't be there. So that your room should be the haven just for sleep. So, and also just to share with you that I have a lot of patients now who work from home, and then I always ask them, "Where are you?" They're in their room. So actually, the bedroom should only be associated with good sleep.
Totoo.
Yes, and then
Work
it's
from
not
home
a workplace.
stations. Yeah, yeah.
Yeah, yeah. So I always tell them to, if you can vacate that room and just reserve that for sleep. So that's important. So in when we treat insomnia, so we try to do stimulus control. That's when you try to bring back the good association of a room with good sleep and with sleep only, and also for married people for sex.
So parang yung bedroom is for sleeping only, similar to yung bathroom is for parang peeing or taking a bath. Ganon.
Yeah. Yes. Your bedroom is needed. Para bang, kasi we have biologic need to sleep. Yeah. If you're hungry, you need food. If you're thirsty, you need drink to drink. Yeah. And if your bladder is full, you have to pee. And if you need to sleep, you need your bedroom. Yeah.
Eh paano Dok yung mga yung mga nakatira sa studio unit? Wala silang choice.
Eh, wala silang
Lahat nasa
choice. Pero
bedroom.
if they're able to sleep without, they don't have problems with this, studio unit, that's fine with them. No? Pero depende sa tao yun eh. So there are some patients who are quite very sensitive.
Mhm.
No? What kaya yung tinatawag na sleep reactivity. No? So changes in the, their environment or any forms of stress actually that heighten their arousal state. So that causes, a sleeplessness. So it all depends on the patient or the individual, I guess.
So sleep hygiene. Yun yung I think yun yung nasa video ni Doc Grace kanina, no? Making sure that your bedroom is not associated with anything else other than sleep or other bedroom activities.
Supposedly.
Okay.
Yeah.
Important talaga yung association and yung sleeping habits. And talking about sleeping habits for parents out there, I think yung question nila would be, how early can they start their children to set up good sleeping habits? And as parents, how can they instill these habits?
Yeah, ipaisingit ko lang to Doc Grace, no? Merong question dun sa chat na related. Sabi ni Jody, no? Thank you, Jody. What is the best hour at night to sleep and to wake up po in the morning? So, whether may with may kids ka or for ikaw lang mismo, no? So maybe we can tie that together.
Okay, April muna.
Okay, so the best hour to wake up, may best hour ba? So it will depend
Pag
on
may
your,
kids ka.
Parang yung ideal situation probably. What suits
it
your,
will depend on your schedule.
activity.
We always say that you have to establish a routine. And your daily routine should include your rise time. So, mention ni Dr. De La Eva kanina na important ang rise time. So, what I do with my patients is I ask, what time do you need to wake up? So, they will tell you, Doc, mga 6 I want to wake up at 6. So what will you do after 6? Wala pa po. No, next activity ko mga 8 or 9. So mahirap stick to 6 if you have nothing to do after.
I see.
So you have to make sure that you can stick to a certain schedule. So if you have a class at 7 and you need to wake up at 6, then we wake up at 6 every day. So yun yung ang tawag dito, correct time for you. So ito yung individualized talaga sa. So walang proper time. What you do?
Sige na para. Yeah.
What you do after, no? Kapag nagising ka na, ano ba yung dapat mong gawin? So you have to get out of the bed because gising ka na you're awake, so you have to get out of the bed. You get that morning sun exposure to set your body clock.
Oh yes, so, very important, the sun.
Once you look at the sun, it turns off your melatonin in the brain, so you're now fully awake. So mas important yun kaysa identifying ano yung oras. It's actually what you will do after, no, once you wake up.
And also, I'm following the 20-minute rule. No? So, like for example, they upon waking up, they can stay in bed awake only for 20 minutes. They shouldn't be lying there like for a long time without doing anything. No? Kaya nga sabi nga rin, going back to what I'm saying, it's only for sleep. And also the other thing, so my advice, it probably depends on the ideal situation. Kung ano yung kailangan mo sa family, with your work, you can set a wake time. And then probably if the patient needs like 7 hours, so you can count backwards. Like set what if you need to wake up at 6 a.m. So of course you count backwards. So baka 11 p.m. would be their supposed sleep time. But you cannot force them to go you can't force anybody to sleep at that particular time. That's unexpected. Tama. Yeah, but you can enforce the wake time. And the other way that you can enforce that one is by using also an alarm clock or ask somebody to wake you up. Okay. And pull you out of the bed, from the bed. Okay, so you give them a time window. So you ask them what in ideal situation, depending on your activity and your obligations, what you think is the ideal time for you to wake up. Okay, and then the bedtime adjusts
accordingly.
Accordingly.
So mas madaling if you haven't set a routine yet. If you haven't set a routine yet, mas madaling ipeg muna yung rise time and then saka kung magbabalik. Okay.
Yeah, definitely. Okay. Because forcing oneself to sleep would be a stressor itself, an anxiety. Yeah. So you cannot force it. So
baka related po yan, Doc.
Sorry? Yung bedtime yung una nilang sineset, yung common na mistake is yung bedtime yung una nilang ina-adjust instead of adjusting that.
Actually, mali yun eh. Kaya doon din pumapasok yung biological clock. That's why we're setting a consistent wake time para at least magkaroon ka ng timer that at that particular time, you have to wake up. Kaya minsan ako, like alam ko, 5:30, gising na ako, nakikita ko yung lagi nauunahan ko at naanohan ko yung relo na 5:30. Now, if you need 7 hours, so kaya dyan nagpa-play nga yung biological clock eh. You need 7 hours, of course, kahit na hindi mo i-force yung sarili mo, kung like for example, 11 o'clock ng gabi, puking ka na. Parang ganun yan. But of course, binibigyan mo din sila is part of like sleep hygiene to have a cut off time. So usually I give them like 30 minutes or an hour wherein they have to stop everything. Stop watching television, stop gadgets. And then, so that's a relaxing time for them and to settle down. And then they can do any rituals as their personal care. And that can help facilitate or you can enhance, all these things can put patient to sleep.
So maybe in part, no, Doc, medyo nasagot niyo yung may isang tanong pa dito sa chat, no, from Dr. Acarizado. How about children daw?
Hi, Gina.
Remain awake up to as late as 11 p.m. to 12 midnight. Baka yan yung baka wala silang winding down, ano? How is it different when handling children?
Yeah, it's quite difficult. Pero yun nga, kumbaga usually a problem with children yung bed resistance. bed resistance. But of course, you have to start. Kaya nga tinanong kanina, at what age do you start uh, para bang yung parang training for good sleep habits? Actually, no, the answer there is as early as 3 weeks old, 3 to 6 weeks old. Okay, so if you already established like a routine and the baby already knows that, but because at 6 weeks, actually they can already develop their circadian rhythm and they can already regulate their sleep cycle. So if you start early, that wouldn't be a problem later on, because that will strengthen their body clock. So kahit na ano mangyari, kahit ayaw pa nila, pero pag inantat sila, because of that body clock, nakakatulog sila.
Siguro po, maybe people with young kids can relate, and I'm sure Doktora April din, as a mother of 3, no? Paano yung, kasi yung culture ng Pilipino, parang pag umiiyak yung bata, ihelin na lang natin, padedehin, ganyan, daming ritual na. Kasi ang hirap, hiyaan matulog na umiiyak, no? Paano po yun? How do we deal with that?
I think as a mother kasi, the child, diba, there are children who are quote unquote difficult, and there are kids who are easy. So what fosters a difficult child and what fosters an easy child? Siyempre yung easy child, ito yung hindi masyadong umiiyak, ito yung mabilis patulugin. Yung difficult, ito yung hindi mo ka-rhythm, kumbaga, no? Dito yung child na hindi mo siya mapatahan. So, bakit nagiging difficult ang isang child? So, let's look at the mother. Sorry for mothers, but it's always the mother. No, so we see if the mother is also not okay. For example, an anxious and a tired mom. No, so kunyari anxious ka na, pagod ka na, inis-inis ka na, hindi siya natutulog. The baby will actually feel that. So, at a mom who is also very in distress, no, mafe-feel din yun ng child. So, you have to be okay. The caregiver should be caring, no? Bakit pag ganun, pag yung isa yung humahawak, mas tumatahan siya, or bakit pag ako, hindi siya tumatawahan? Kasi nafe-feel niya yung stress mo rin eh. So, when you handle your baby, you have to be okay. Aside from that, you also need to establish your routine para sumunod na siya, no?
Yes.
The baby will follow naman your routine eh. But if the baby also senses na parang ang gulo-gulo nung routine ng parents ko, mawawala din siya doon sa rhythm na yon. So, I think si Dr. De La Eva, he made mention about children na kailangan i-drive sa car, kailangan ikot sa sasakyan para lang makatulog. May mga ganun pa.
Mahal lang gas ngayon. Din pa naman, ida-drive mo pa.
Actually, yun yung tinatawag na sleep onset association disorder. Huh?
Okay.
Yeah, also they have to know also that actually that to train yan para for them to become they can self-soothe.
Okay.
Which means to say that they can sleep, kasi usually like every 90 or 60 minutes, sometimes they can have arousals. But if, like, for example, the mother should know that that's normal. Okay. But the proper way of, like, for all these habits not to be developing is that you have to give the baby as early as 3 or 6 months to soothe themselves. Okay. To soothe themselves by, like, allowing them to sleep by their own. Kasi kadalasan, a good practice is, like, the mother should be able to recognize when the baby is already sleepy. There are signs where when the baby parang nangangiti ang mata, nagayon, o kaya parang blank stare. So pag ganon, that means to say that the baby is already sleepy. So the baby, while the baby is still awake, you have to put the baby already on the crib. So you give them an opportunity for themselves to become independent and to be able to sleep by themselves. No?
Okay,
Kaya,
okay.
And don't let them, sorry, and don't let them, sleep on your, while being cuddled. Kasi that's the problem. That's why that's the start of sleep onset association disorder. Kasi hahanapin ka nila eh. Yeah, you become a transitional object for them to be able to sleep, especially the mother. And of course, if that develops, of course, there's what you call yung extinguishing, extinguishing delay in saklolo, no? So, but of course, in the part of the parents, they have to uh, practice firmness. They have to be firm. Pero of course, that would be difficult for Dr. April. Pero I would like to emphasize here is that you may not experience all these problems had you started training them early.
So I guess ang key learning po dyan ay our babies are tougher than they look. we can afford to start them on early, no, with good sleeping habits na helpful pala if early on, no?
Yes.
And siguro sa magulang, no, maybe it's a cultural thing. Unless you're prepared na maghele hanggang 10, 15 years old na sila, wag niyo simulan. Wag niyo ituloy-tuloy.
Wag na simulan.
Kasi pero, tayo din naman nagrereklamo, ba't yung baby ko ayaw matulog?
Pero common to sa mga first baby.
Yes,
no? Yes. The sick baby na nagkasakit sa ICU. So the parent becomes very protective. And the more if you have mga in-laws, nako, patay na.
Okay. Ano naman? Okay naman. Let's putulin na natin yung usapan doon. Baka may mga baka mabalik usapan ng mga guests doon. But thank you, Dr. De La Eva. Thank you, Dr. Hernandez, for your input on that. No, it starts with the parents. Good sleep habits, starting with the parents, will help you develop good sleep habits for your children. So let's move on. So yun nga, the concept of sleep hygiene na turuan nyo kami, na mention ni Doc Grace, and through all these sleep tips that we've discussed. No? So ang bago kasi ngayon, 2020, since 2020 pandemic, hygiene, alam ng mga tao yung hand hygiene, mask hygiene, pero ngayon nakita natin na sleep hygiene pala is also a thing. No? There's such a thing. Diba? So yan ang bagong natutunan natin ngayon, di ba, Grace?
Yes, pero Pito, what if na-apply na nila yung sleep hygiene or yung good sleeping habits and they still have trouble getting good sleep?
Oo nga, no? Paano yung mga ganun? Na lahat na ng sinabi natin, lahat na ng ginawa natin na tips, na life hacks, no? Na pag ng mga blackout curtain, ganyan, kung pagsusuot ng mga takip sa mata, white noise. Pero in the end, hindi pa rin. No? Ano ba yung ibig sabihin nun? Ibig sabihin ba nun? Kailangan na magpatingin? Kailangan na magpa-consult? No? Let's see. So let's say you've done all the life hacks to promote good sleep hygiene and made sure that you've allotted enough time in your day for sleep. But despite your efforts, you find that you still can't sleep well. You might need to
putol.
So let's say you've done all the life hacks to promote good sleep hygiene and made sure that you've allotted enough time in your day for sleep. But despite your efforts, you find that you still can't sleep well. You might need to get checked. It is common to lose a couple nights of sleep after an extremely stressful life event, like losing your job or ending a relationship. But for some, sleepless nights can persist for weeks or months, even after the initial problem has already resolved. This can be true for those who might be predisposed to insomnia by factors such as age, sex, or genetics. People who work night shifts, and those with psychiatric or mood disorders like depression or anxiety are also at risk. If poor sleep remains unaddressed for quite a while, they may develop maladaptive behaviors that can perpetuate insomnia even further, feeding itself into a vicious cycle. On the other hand, others have no problem falling asleep at all, and in fact find themselves sleepy when they need to be awake. Despite getting what they believe to be a full night's rest, they still feel fatigued in the morning and possibly throughout the day. These people may be suffering from sleep-disordered breathing that can interrupt their sleep multiple times in a night, causing shallow and poor quality sleep. Those who always feel tired are a bit on the heavy side, snore often, and sound like they're choking when they snore. Especially males with high blood pressure are particularly at risk. If you feel that you experience any of these symptoms, you should consult with your sleep medicine specialist who would best know what diagnostic procedures to recommend. Good thing we have them here with us today. All right, no, nagka-konting technical difficult tayo doon, pero that's life. Hindi na bago yan sa atin, no? So yun nga, no, we talked about what you can do to have good sleep, no, good habits, hygiene. Pero if you continue to have problems even after applying all of those, dapat mag-consult ka na sa sleep doctor, di ba Grace? Di ba Dr. Hernandez and Dr. De La Eva, no? So now we're going to talk about, I know nadaanan na natin kanina yung iba, but let's just talk more about some of the signs to look out for that could point to a need na kailangan mo nang ma-evaluate by a sleep specialist, no? Grace, di ba?
Okay, again, thank you everyone for being very engaging with your comments and your questions. Of course, some matters are very specific, might be better addressed in a formal consultation. But we'll do our best to hear you out. So, Pito, carry on.
Okay, sige, no? So, yun nga, for one, no, I think may nagtanong kanina, unahin na natin yun. No? Sabi dito from Z. Is this a ZII? ZE? Anyway, Mr. or Miss Z. What should I do to prevent keeping on dreaming? It makes me tired even if I sleep for at least 7 hours when I wake up. So I guess ibig niya sabihin ay meron siyang vivid recollection ng dreams niya. Tama ba? No? And pagod pa rin siya pagkagising niya. Ano kaya yun? Who wants to go first po?
Yeah.
Okay.
Yes. Actually, nobody can stop us from dreaming. Yeah. But usually it's associated with rapid eye movement and sleep. So we have to go back that there are two dimensions when we talk about sleep in terms of being restorative or conservative. So there's what you call the quantity and the quality. And it looks like the quality is the one which is suffering here because he feels tired upon waking up. And if you associate the dreaming, I just don't know whether, like this patient has a sleep disorder breathing, which usually occurs during rapid eye movement sleep. For most of the time, we do dream. But all of us do dream, but usually we don't recollect because usually when that happens, like if you're able to consolidate that dream state and then you go past that dream state and then you wake up at a different sleep state, you wouldn't be able to recall that one.
Nabubura na, na-overwrite na yung memory
So I
card.
surmise that probably this patient is having some arousals during REM sleep where he's dreaming a lot. And that's why he's getting recollection. Okay? Yeah, so I guess that's what my impression of him, that it's affecting the quality of sleep and of course REM sleep associated with dream. So the likely chance of having like a sleep disorder breathing may be present. Is he a male or a female?
Not clear dun sa pangalan, ZII, that could be any. Pero in any case, no. Ano ba?
Just make him a male. A male.
Pag male, pag male, ano ba?
Yeah, of course, a male. Obstructive sleep apnea is more, that by gender, obstructive sleep apnea is more common among males. And then, of course, if you can still ask further, so are they overweight or are they obese? But we don't have the information.
Baka hindi sasagot, Doc, ngayon.
No, I just hope that that answers the question. Let's hear from Dr. April.
Yeah, there. Z is female. So she said female daw siya.
Female.
Okay.
So aside from sleep disordered breathing causing arousals during REM sleep, as Dr. De La Eva said, we always dream. We experience dream every night. Unfortunately, we go through the cycle, the REM sleep, 3 to 5 times every night. So yung question is, bakit mo siya naalala? Bakit mo siya nare-remember? So they said, dream recall is associated with anxiety and depression. So when I get patients who complain about dreams, I always ask the content. So what's the content of the dream? So if the content of the dream is yung nakakatakot, or hinahabol ka, or pagising mo, iyak ka ng iyak, no? You're very emotional, then I investigate further about psychiatric conditions like PTSD, trauma, depression.
Post-traumatic,
Yes po, anxiety. So yun yung hinahanap ko. So they said when we treat them with antidepressants, they would still dream. So nandun talaga si dream. We cannot avoid that. But the content of the dream is changed to a more tolerable theme. So yun yung possible pa na na-experience niya.
Because Dr. April, correct me if I'm wrong. Huh? So usually these patients will have like anxiety or any problems. Usually they have this hyperarousal state that easily they arouse every now and then. So their sleep becomes fragmented and disrupted. So if they dream, so usually they get to recall what they dream. So while they're dreaming, when sleep is disrupted at a particular time, so of course you get to recall what's happening.
Yeah. And they also suffer extended wake
Hindi makabalik ng tulog. Hindi makabalik, oo.
So more chance of recalling their dream. Kasi 'di ba, if you just woke up for few minutes, you will have an amnesia of the event eh. Hindi mo na maalala ka. Pero dahil ang haba, hindi na sila nakakabalik sa tulog, so nare-remember mo pa yung content.
Yun yung reason kung may nanaginip ka tapos nagising ka in the middle of the night tapos naalala mo siya pero pag natulog ka rin kaagad di mo na siya maalala sa umaga. Dr. De Leva,
so you've heard so you've heard the opinion from the psych part and also from the
ang galing,
part.
No? Ang galing. Okay? It's both facets.
So we have but of course we need to see the patient. Of course if you are able to see the patient probably you can evaluate better. And you can say what's really causing the problem.
Yes, so Ma'am Z, you might need to consult. Okay, let's stay on the topic of dreams for now. Kasi I'm sure a lot of people are wondering or a lot of people have experienced this. Is that the same, having recurring dreams emotional, is that the same as bangungot? Or is bangungot a different thing altogether?
Okay, can I answer that first?
Sige po, Dr. De Leva.
Bangungot actually is usually it's being used wrongly or incorrectly. So bangungot, if you translate it to English, that is sudden, unexpected nocturnal death. So there's a component of death. Kung sinabi nila, binangungot ko kagabi, ba't ka nandito pa?
Multo na yung kausap mo.
Yeah. So kasi, sometimes they interpret like bad dreams coupled with sleep paralysis. For them, that's already bangungot.
Yes.
Pero in strict sense, I don't think that's it. No? Bangungot is a different entity.
Okay, so guys, di kayo pwedeng bangungutin and live to tell about it kasi death ang katuluyan, no? Pero maybe sleep paralysis would be the more common and people are using bangungot to describe sleep paralysis. What is that? Ano po yun?
Sorry. Dr. Hernandez, I think.
Oh yeah, sige. Dr. Hernandez.
Sorry.
Walang term ata yung sleep paralysis in Tagalog eh. So, pero I think yun nga yung dinidescribe nila. It's when you are awake but you cannot move. You cannot move your body. You transition from sleep to wake. So what happens ba? Ano bang nangyayari? Bakit natin na-experience yan? So this is awakening during REM sleep or the rapid eye movement sleep stage natin. So this stage is where we experience vivid dreams. So when we experience vivid dreams, when we enter that stage, our whole body is in a paralysis. So wala tayong muscle tone. So the reason for that is for us not to reenact the dream. Sabi na nanaginip ka. So if your body is not in that paralysis, mag-move ka. So kung tatakbo ka, edi gaganon ka nun, di ba? So ang ginawa ng katawan natin is nasa paralysis tayo. But if there's a reason for arousal, so sabi natin, what if bigla kang nagka-sleep up or nagka-apnea ka during REM or suddenly may loud noise na nagising ka or any awakening during REM na nauna yung brain mong naagising but your body is still in that state of paralysis, then you experience the sleep paralysis nga. So nauuna kang magising kaysa dun sa katawan mo. So some patients would also complain of hallucinations. So parang may nakikita sila, parang nandun pa sila sa panaginip. So minsan gusto nilang sumigaw pero hindi kaya.
Walang lumalabas. Yung merong pang itim, yung merong itim na nakadagan.
Yeah, it's a
mga
deep dip.
sinasabi.
Yeah.
Yes, yes.
And they
So
cannot breathe.
that's hallucinations, but it's considered normal when you transition from sleep to wake and you experience hallucination. Hindi siya psychotic. So hindi siya dahil nawawala ka sa realidad. It's because you're transitioning. Pero nahuli lang, na-delay lang yung katawan mo. So, kailan nangyayari yun? So, kapag nagising ka sa REM sleep, so kung ano man yung reason ng awakening mo at hindi pa naka-recover yung katawan mo agad.
Yeah.
So,
In addition to that, yung mga pwede bang adding causes. So, actually, yung mga like anxiety and also poor sleep or sleep deficiency or sleep deprivation.
deprivation.
If you're sick, this can come out. Actually, I experience it myself once in a while. And the most horrible experience is that you try to move and also you cannot breathe.
Yes, I can relate, Doc, kasi I personally also experienced that.
And and also
pati yung hallucination.
Laging hinahabol ako ng patay.
Oh no. So ibig sabihin, Doc.
We have a question pala from the
Oh yes,
audience.
Grace. Yes,
Yes.
We have a question from Mr. Oziel. Is there a proper position to sleep to avoid sleep paralysis?
Doctora, do you have any thoughts about that?
Question po, Doc, is there a proper position to sleep to avoid sleep paralysis?
Parang iniisip ko lang is if the arousal is due to sleep apnea.
Yeah.
So dahil hihinto ka sa paghinga, then you avoid a supine position.
Correct.
Okay.
On
So
your
fine
side.
lying on your back. Oo.
Yeah.
Okay.
Lying in your back. So,
Okay.
yun, right side ka or left side na position.
Nakatagilid. Yeah.
Oo, nakatagilid. But if yung reason is sleep deprivation, kulang ka sa tulog, you're going to any psychological or distress, so hindi kakayanin ang position yun.
Matulog ka, ibig sabihin. Kulang ka sa tulog talaga.
Kulang ka sa tulog, oo.
Doctors, let's
for the just for the individual who gave us the question. Just in addition to that is that of course because when we lie on our back, our tongue usually drops into our throat by gravity. So if we're talking about or thinking about the line of sleep apnea.
Sleep apnea. Papunta na tayo doon actually, Doc, ano? We've mentioned it several times. We've mentioned sleep apnea several times, pero I'm sure medyo sikat na yan, mas sikat na yan nowadays dahil sa mga tulad ninyo. Salamat. Pero some might be unfamiliar. Ano po ba yung sleep apnea? What does that mean? Ano ibig sabihin doon?
Alright. Muna.
Sleep apnea is an obstruction in the upper airway. So may bumabara sa ating lalamunan, sa ilong, sa tonsils natin, or sa dila, pwede din sa leeg kapag tayo ay natutulog. So kapag merong bumabara, may kumikipot na daanan ng hangin, we snore, no, kapag humihinga tayo. So kapag huminga tayo kasi, nagvo-vibrate yung mga obstruction dyan, kaya naririnig nyo yung snoring. So kapag konti lang yung hangin na pumapasok, the oxygen is also less going inside our body. So we experience desaturation. So sikat yung oxygen desaturation.
Dahil sa COVID, lahat meron ng gano'n.
Lahat, alam nyo kung ano yung oxygen desaturation. So, bumabagsak ang oxygen habang natutulog. So kapag na-sense ng brain natin that we don't have enough oxygen in the body, our brain will wake us up. No, ayokong tawag doon, demonstrate yung sound, pero it's a choking sensation.
Ayan. May nag-demonstrate. Sino yun?
Ako yun.
So,
alam ni Doc.
Sounds kapag natutulog kayo, sometimes wake up coughing or gasping for air. So that's obstructive sleep apnea. So it occurs multiple times all throughout the night. As long as you're sleeping, umihinto yung paghinga mo. So,
okay. So yun yung sabi ni Doc, yun yung isang sign, ano, kapag parang nagsusnore ng malakas, parang let's say parang barko na or parang tricycle, tapos nabibitin yung hinga. Kahit hindi malakas, pero nabibitin yung hinga.
Yeah. And they have to know that obstructive sleep apnea can occur even in neonates, infants, and any age group.
Oh no.
Yeah, so na-mention ito by adenoids, probably a lot of people know that the peak age is from 2 to 6 years old, but there seems to be like a second peak during teenage group wherein usually it's the obesity which becomes a contributing factor.
Okay. So Dr. De La Eva, sabi niyo pwede sa neonates. Before we talk about the adults, sa bata, ano ba yung signs na baka meron silang obstructive sleep apnea pala?
Yeah, for neonates or infants, of course, sometimes there are infants who snore also. Bisa sabihin na nag-snore parang matanda. No? Pero but basta importante is that you have noisy breathing or audible breathing.
Okay, in
so
infants.
If there's audible breathing, that means to say that there's partial upper air
obstruction.
Okay. And based on age groups, you have different, possible contributing or risk factors for them. So of course, in the neonatal period or the infancy period, you would think more of like the congenital abnormalities, like deformities in their craniofacial structure. So, but when they reach 1.5 years old, up to 6 years old, causes an adenoids. But we know that after a while, usually they regress in size.
Immediate.
Yeah, but they tend to gain weight later. And in adults, actually the most contributing factor, the greatest contributing factor is still weight or obesity.
Pero in terms of behavior sa bata, are there any differences to observe? Ano ba yung signs na kunyari sa school? Ano ba yung baka may OSA yung bata?
Yeah, it's actually there's a lot of evidences to show that even snoring can give you neurobehavioral problems. So in pediatric patients who have obstructive sleep apnea, unless that it's very severe, usually they don't present with daytime sleepiness. They present with symptoms just like ADHD.
Malikot.
Malikot, hyperactivity, and they postulate that this possibility of self-stimulating thing for them. That's why they move a lot, no? So, but the truth is probably they still feel some sleepiness within themselves, no? But if you have older children, especially the very like obese and also with severe, that's when we see also the picture of how adults do present with daytime sleepiness.
Pag medyo kunyari nasa teenage years na sila.
Kaya yung mga pasyente nakikita ko, madalas na-refer sa akin, nakita mo, they can sit still. Nakita mo, gumagapang sa ilalim ng table mo, binubuksan yung refrigerator mo, binubuksan yung mga drawers mo. No? Okay, and then pag tinanong mo yung mother, is your child hyperactive? Ay, hindi po.
Normal lang sa kanya yan.
Yeah, kasi siguro it's been going for a while. That's why
I see.
She has accepted it as normal.
I see.
Yeah.
So, thank you Dr. De Eva dun sa mga bata, no. Dr. Hernandez, it's been mentioned already na ang isang manifestation ng symptoms ng obstructive sleep apnea during the day ay yung sleepiness, no? Kasi hindi nga maganda yung quality ng sleep mo during the night, no? For those who have partners, at least now observe na baka nabibitin yung hinga, no? Mihilik, pero yung sa mga single dyan, sorry na lang, pasintabi po, baka mapansin niyo na sa umaga antukin pala kayo, no? How do you distinguish that from, kasi you're in psychiatry, paano mo ma-delineate yun?
Actually, it's difficult, no? Kasi there are depressed patients who also manifest hypersomnia. There are also hypersomnia disorder, no? Ito yung mga narcolepsy, Klein-Levin syndrome, idiopathic hypersomnia. So, paano ba natin dinidelineate kung obstructive sleep apnea ba siya? Siyempre, you have to rule out muna na kung obstructive sleep apnea. So, we use a certain screening tool, yung stop bang, tapos yung Epworth Sleepiness Scale. We also use that to assess kung antukin ka ba talaga. So if you reach the score of 10 and above, then you're really sleepy, you have excessive daytime sleepiness. So yun, you have to see the patient first before you know na it's psychiatric or it's a sleep disorder.
So in short, guys, magpa-test po tayo, mag-consult tayo.
Yeah, and Dr. Pito, in addition to that, of course, you cannot, leave a patient without examining the patient. So of course, if you have, like for example, if you try to ask them to open their upper airway and you can see that it's very crowded, you have some deformities in your chin is very small. Bakit ka tumawa?
No offense po sa mga nagko-consult sa amin, no offense pag dina-judge namin yung mukha ninyo, pero part po yun ang trabaho namin.
Kasi, kasi alam mo, kadalasan, what I learned in Sydney is that it's a mentor ko. Usually, yung mga people who have small chin, they grow big.
Yeah.
Kaya medyo natawa lang ako kasi si Dr. Pito. Pero I'm not saying ikaw yun.
Okay
Yeah,
lang,
so,
Doc. I accept.
So yeah, we make use of the scorings like Malampati scoring. We also take note of their body mass index. We take note also of their Brodsky scoring, like for your console. So at least you have to exhaust everything. Huh? Okay, tama si Doktora na pwedeng may overlap or we don't know whether it's because of psych or because of it's more of like sleep disorder breathing. But of course, everything should be, all the informations and all the, information we get from TB, history, and everything should all be consolidated.
I see. So in short, talagang kailangan magpa-consult. No, we're almost out of time, but I don't want to end without asking this, leading into this before we go. So let's say nagpa-konsulta ka na, tapos sabi ng doktor mo, kailangan mo magpa-sleep study. Ano bang ibig sabihin nun? Maybe just a quick idea, parang patikim lang so people will know what a sleep study is. Ano ba ibig sabihin nun, Doc?
Doktora.
Sleep study is a sleep study. Matutulog kayo sa laboratory namin. So, tatanungin nila, ilang oras po ba yan? Siyempre, kung ilang oras po kayo natutulog. So, we need around 8 hours of recording time. You go to our sleep lab. We attach a lot of wires in your body, a lot of straps. And the reason for that is to give us an idea what's happening in your body while you sleep. Your brain waves, titingnan namin, yung breathing nyo, paghinga, heart rate, oxygen levels, body movements, your leg and your hand movements. If you grind your teeth, makikita din namin yon. So lahat yon pag-aaralan namin at babasahin namin to see if you are experiencing sleep disorders. So the most common would be obstructive sleep apnea. Ito yung paghinto ng paghinga habang natutulog sa gabi, as I've mentioned earlier. So kapag meron kayong more than 20 in the first 2 hours, per hour, kakabitan namin, we attach it to a CPAP machine. So that would be the therapeutic part of the sleep study. So the goal for the therapeutic part is to identify the pressure that you need for your PAP machine. Ano ba yung PAP machine or positive airway pressure machine? So ito yung machine na kumukuha, it gathers air in the environment to pump into your airway through a mask. No? So may mask kang isusot. It could be nasal or in your mouth or full face na mask. So yung goal niya is to pump air so that the obstruction in your airway, mag-move out siya and then makakahinga ka ng mabuti. So once we end the sleep study, the goal is to attain the pressure for your machine. So, isa lang ibig sabihin nun, gagamit ka na ng machine na yon every time you sleep. So, tanong nila, hanggang kailan po ba kami gagamit? As long as you're alive, as long as you sleep, kailangan gamit mo yung PAP machine na yun.
As long as di ka pa binabangungot.
In pediatrics, it depends on until when they need. Because like for example, due to patients' parental preference, sometimes they would like CPAP instead of surgical intervention. So we know that sometimes there will come a time that they'll go out of their terms and adenoids will regress in size. So of course that's the time that they can have an opportunity to graduate from CPAP. And also the other thing is sleep study is considered as gold standard. So we have a lot of screening tools. But sleep study is still the objective and the reference standard, and nothing can beat that. So it's measuring many physiologic signals. Some were already mentioned by Dr. But of course, we can also take thought of if the patient is, having periodically movement disorders or any abnormal movements that disrupt their sleep. Even teeth grinding can also be shown in there. And many others. So, but of course, you need expertise of the ones who perform or who does the sleep study and who score and interpret it. And I'm happy that we are with St. Luke's,
Oh yes,
the
and we offer
pioneer
that.
of sleep study, because we've been doing sleep study since 1993.
Back in the time of of sila Andrew E. 1990 sleep study.
Yeah, but formally the comprehensive sleep disorder was started in 2000, in the year 2000.
And thank you very much, Dr. De La Eva.
Doctor, sa pasarap na yata ang usapan natin, but I'm afraid that's all the time we have for tonight.
Teka lang, Grace, ang aga pa, 7 o'clock pa lang. Are we really about to cap things off?
But of course, we want to give everyone a chance to apply what we've learned, don't we?
Oo nga naman, World Sleep Day kasi.
Saka hindi dapat sagad-sagaran, di ba? Dapat may cut-off time.
Tama. O, papalapit na tayo doon. No? So indeed, we've learned so much this evening from Dr. Hernandez and Dr. De La Eva. No, we cannot thank you enough for sharing your time and your expertise. Thank you.
So maybe we can ask for some final takeaway messages from our special guest.
Final answer. Sige, good idea, Grace. No, sige, paano ba to? Ito na yung parang pang Miss Universe na takeaway, di ba? So sige nga, simulan natin kay Doc Pim Hernandez. Short and sweet question lang, Doc. Dr. Hernandez, what is the secret to getting good sleep? Short answer.
There's no secret. There's no major secret in getting
major.
I will just quote mag-quote na lang ako. Si father of sleep medicine, si William Demet. He said that sleep is an essential part of life, but more important, sleep is a gift. So like any other gift, we have to take care of it. Dapat hindi natin siya binabalewala, because it is swerte ka if you get a good night's sleep. That is something that we usually hindi natin masyadong pinapansin yun, di ba? Pag maganda yung tulog natin. Pero pag hindi na siya okay, doon na tayo na-fixate, no? So if you're still having good night's sleep, then you have to be very thankful, because again, it is a gift. Thank you.
Yeah.
Very nice.
I like that answer. Dr. De La Eva, what is your message to people who are hesitant to have themselves evaluated for their sleep problems?
Yeah. Actually, there are some sleep problems which can be sorted out by oneself. However, there are even more sleep problems that need the help of a doctor or a sleep medicine expert, even the evidences are overwhelming that sleep problems can have a great impact on one's health. And there are a lot of medical complications attached to unsolved sleep problems. So I should say, and it has to be remembered, that sleep and wellness are inseparable.
Very nice parting words. Perfect to cap off the night. Sleep and wellness are inseparable. So thank you, Dr. De La Eva. That was beautiful. Again, thank you very much, doctors, for your time. And of course, thank you, St. Luke's Medical Center, for making this evening possible.
And thank you everyone for being with us here. If you have any inquiries regarding our services or the schedules of our doctors, you may get in touch with us by contacting the numbers flashed on your screen.
All right, no? So, paano, Grace? Paano na? Good night na tayo.
Good
Let's
night.
call it a night.
Call it a night. Sige, we can really celebrate World Sleep Day na after this.
Lalo na yung mga may chicken dyan.
This is with Doc Grace.
And I am Doc Pito, reminding everyone, let's sleep on it. Thank you, docs. Thank you, everyone.
Bye. Thank you.
Bye.
Bye-bye.
No picture taking?
Picture?
Ay, of course. Sige nga, mag-picture tayo. Why not? Okay, thank you, everyone.
Thank you. Good night. Bye-bye.
Happy World Sleep.
Yeah. Bye.
Bye-bye.